I'm just going to introduce Amar Shah now, who's our National Improvement Lead at the college and who's led all of our quality improvement national collaboratives that we've run so far. So Amar, as well as doing that, is the psychiatrist and Chief Quality Officer at East London Foundation Trust. So hello, Amar.
Hello, you've done a great job of introducing me, Tom. So welcome everyone. Thanks for joining. I really hope in the next 40 minutes or so we'll be able to have a conversation to help you decide whether this is going to be a valuable experience for your teams to go through. So please do ask whatever's on your mind to make sure you're satisfied to make a decision about whether you want to put teams forward for this opportunity. And Tom, should we just introduce Mihaela as well? So Mihaela's with us for the next 15 minutes.
Yeah. Excellent. So Mihaela, who is the chair of the college staff wellbeing committee and also psychiatrist at Sussex Partnership Trust. Mihaela, if you would just say hello, please.
Good morning. Great to be here and great to see everyone, and really good to see Jonathan West from my trust as well. So yeah.
Excellent, thank you. So as I said, the format of this is just going to be a Q&A, and hopefully the questions will all come from you. I'm going to start by asking Amar a question or two, and I can keep going with that, but I hope that people interrupt me and have questions of your own that you would like to ask. But I'm just going to start by asking you, Amar, why we thought this was a good idea. Why are we launching an Enjoying Work collaborative in this way?
Yeah, great question, Tom. Actually, we came up with the idea before COVID was even an entity. And what we wanted to be able to offer to the mental health field was a way for teams to focus on how they work, their experience at work, and to be able to use quality improvement to really give them an opportunity to own the process of understanding the factors that relate to their experience at work, what gets in the way, what contributes to them having a better day at work, and come up with their own change ideas that can make a difference. And I guess this draws on two things. It draws on the evidence base around staff experience and joy in work, which is now about 5 or 6 years old since the IHI, the Institute for Healthcare Improvement, first introduced the term joy in work with a really rich white paper which full of the evidence base, and applying the method of quality improvement now, which we've been doing at ELFT for about the last 3 or 4 years now, because we recognise that just our usual approach to the NHS staff survey findings wasn't enough. There was still a lot of variation within our organisation, and we wanted to devolve this down to our teams to be able to really own the process of influencing the system that contributes to their experience in their day-to-day work. So we wanted to bring together the evidence base and a method that allows teams to really own this. And so, given the experience we've got now of running large national improvement collaboratives hosted and run by the Royal College on topics like suicide prevention, restrictive practice, sexual safety, which I think have been really, really helpful for teams that have taken part in enabling them to really understand the factors, come up with their own ideas and test them out using a single method that allows them to share and learn across the community. We thought this would be something that everyone would find helpful, potentially. It's not something that, it's a topic that obviously applies to everybody, whether you're a clinical team or a non-clinical team, whether you're a mental health team or a non-mental health team. And we thought this might be a really good first topic for us to pick as a different type of collaborative, a subscription-based collaborative. So we wanted to offer it to the community and see whether there was interest in giving this a go.
Thanks, Amar. And you just touched on the fact that we're doing this a little bit differently. This is a subscription-based collaborative. So our previous ones, which I guess some people on the call are aware of, were the improvement collaboratives that you mentioned around restricted practice, sexual safety, suicide prevention, and individual teams didn't have to pay and subscribe to be part of them. They had to put themselves forward, but there wasn't a financial cost. They were commissioned centrally, and we're still commissioned centrally to run improvement work, but we thought that we could offer something in addition to that, and this is the way that we would fund it. But I suppose if it'd be really helpful to think about, well, what will people get for their money? What would be what does being part of one of our collaboratives mean for people, and why would they want to invest in that?
So what would people get? Well, they would get a QI coach, the same QI coaches that have been working with teams for restrictive practice, sexual safety, suicide prevention. So they're really skilled at helping teams through the systematic process of understanding the system and then improving the system. They'd get access to the community. So the teams will all be coming together every couple of months in learning sets that are virtual at the moment, but we hope we may be able to turn face to face at some point, where we'll design the space to enable teams to really learn from each other and accelerate their work. They'll get access to the web platform we've been using for all of our improvement work to document and share their PDSAs and their data. They get access to content experts, people we can bring into the learning sets to really help them think about the evidence base and the innovations that we know contribute to a good experience at work. So it would be, joining a year-long program. So they'd have support for pretty much a year to work on this particular topic.
Okay, thank you. And what can you give us, just to make it tangible, what sort of things the teams who will be on an Enjoying Work Collaborative do? What are some of the change ideas that they would be actually testing and putting in place in their teams?
Yeah, that's actually a difficult question to answer, Tom, because we've had about 50 teams at ELFT go through this almost exactly the same kind of program, obviously just run within one organization over the last 3 years. And although they go through exactly the same systematic process and we guide them through it, the change ideas are so contextual and local that they're almost difficult to apply elsewhere. I was just listening to a team this morning talk about, this is a psychology team from Bedfordshire and Luton, talk about the work they did last year. And they tested a number of change ideas, one of which was what they called positive gossip. So they tested this new change idea, which was about really sharing something positive about someone in the team, and they found a systematic way to introduce that into the way they work. Other teams have tested totally different ideas, such as finding ways to introduce well-being activities into the way they work. So desk yoga, or different ways for the team to be coming up with their ideas around what would help them stay healthy and well. So it could be a whole range of things. Many teams obviously right now will be thinking about how they operate. Given lots of change in the way we work together as a team, this process would also help the team figure out what's working about the new ways in which we interact with each other. How do we interact? How do we work together? And are there better ways of doing that? What seems to be working? What doesn't seem to be working? So many teams have really tested ideas that relate to team functioning, participative management. So how do we really involve people in making decisions in the team? There's a lot of change ideas focused on camaraderie, so really encouraging people to get to know each other and get a sense of togetherness and friendliness, because we know from the evidence base that if you have a friend at work, you're 7 times more likely to be engaged in the workplace. Lots of change ideas related to recognition and reward, teams finding ways to just recognize the great stuff that we're all doing in our teams. So things like Star of the Month. I mean, they're not rocket science ideas. None of them are things that we wouldn't necessarily come up with, but it's the process of enabling the team to just have a bit of space to think about, right, what could make a difference? What really contributes to us having a good day at work? Measuring that reliably so we can understand the variation. Are Tuesdays a better day during the week than every other day? And what might be underneath that, so we can do more of what we do on Tuesdays? And then coming up with their own ideas that they really own, they test, and then they tweak before they think about just adopting it into the way they work week to week. So the change ideas, Tom, are really so varied. It's difficult to standardize. But from the 50 teams we've had or so, lots of them are focused on recognition and reward ideas, and a lot of them also found ways to just be together more. Pre-COVID, that was often about having a meal together or finding a way to actually spend time together regularly so that we can build the relationships and camaraderie within the team.
Thanks, Amar. Mihaela, I wonder if I could bring you in at this point. thinking about the obviously as your position as chair of the Wellbeing Committee at the college, what's your perspective on this, and why do you think this is a useful contribution to the space, I suppose, or hopefully you do think that?
Yeah. I very much think that this will be a process which will enable teams to come to with their unique ideas about what works for well-being. We know very well that every team, even in the same area or in the same trust, they are unique. They have their own challenges. They have their own opportunities to make it better for well-being. So this process will provide the tools the QI tools to enable this change, but at the same time cherish the uniqueness of each team. And I think ultimately this can contribute to transforming culture, because even if in an area of a trust a team is engaged in this process, I think there is so much opportunity to learn and enthuse the other teams in a certain area or in a certain team to go through this change. And I think transforming culture it's so important. I think it's one of the most important parameters in relation to well-being. And we know well-being is such a broad term and involves many things apart from supporting, let's say, staff to get supported, to get the right care, let's say, at the right time when they struggle. It's ultimately it's about the culture, it's about the value, and I think this process, this initiative can have the potential to make a big difference. So I'm very positive about this, and I'm delighted to be part of it. Thank you.
Thanks, Mihaela. Just want to check if anyone else has any questions. So we've got one there in the chat from Richard in Leeds. Richard, do you just want to? Are you able to just talk? I'll come to you in a second as well, Anna. Are you able to just, Richard, say a bit more about your question?
Yeah, I suppose I'm just interested in looking, the variety of organisations on here, and I know we've all got slightly different approaches to, the underlying principles will all be the same, I'm sure, but slightly different approaches to improvement. And I suppose I'm just wondering, with the improvement coaches, do they adopt their approach based on what the local improvement tool is, or methodology, or are we going to have a standard one across this community that we use? And I guess it's how we marry those two up.
Yeah, that's a great question. Amar, would you like to?
Yeah, it's a good question, Richard. There's a lot more similarities between methods than there are differences, actually. So I'm not too worried about that, Richard. We in all the big national improvement collaboratives we run so far, we generally adopt the model for improvement. But there's not a lot of difference. If you were using the Toyota production system, for example, you would still be using PDSA cycles of testing. You would still be collecting data to understand change over time. So actually, we're not going to be teaching people necessarily new methods. So I don't think it will cause a tension within the team. What we will be doing is bringing people tools like appreciative inquiry. For example, if they really want to understand what contributes to a good day, we'll give them tools to help them run that session in their team and maybe facilitate it for them. And that I don't think conflicts no matter what method you're using. So we'll give them platforms so they can put their data in. We'll show them different data collection techniques. I don't really see there being much tension in the choice of method we're using and what you each have in your organizations.
That's great, thank you.
Yeah, I would just add that in our previous collaboratives, we've kind of, where teams or trusts have got QI coaches of their own, we sometimes work alongside those QI coaches, and sometimes they've been used for a different method. But as Amar says, we find the similarities and work with that. I don't think it's really caused a problem so far that I can think of in that respect. Anna, had your hand up.
Hi,
for a while.
I have.
Hi.
Thanks. Anna Forrest, I'm a consultant clinical psychologist at Cambridge and Peterborough Foundation Trust. Really interested in this project because we've been thinking about joy at work for some time within the Older People and Adult Community Directorate. I had a couple of questions. You mentioned, Amar, that obviously this is applicable to non-mental health teams as well as mental health teams, but for the purposes of the collaborative, do you just want mental health teams, or could it be a non-mental health team?
Yeah, great question, Anna. I'm relatively relaxed about that, Anna, because at ELF we've got wheelchair services, we've got finance teams, even our exec team have gone through exactly the same process, and it doesn't really matter. So if you're comfortable with it, I'm comfortable with it.
What a time to put me on the spot, Amar. Yeah, no, we have had because of course many trusts provide more than mental health services as well as their corporate services, and we have had other organisations ask if they can join this, and we've said, obviously we are a mental health organisation, but we certainly have flexibility around that. So if we would say any teams in your trust want to be part of this, we would definitely work with them.
Okay, that's really interesting, and I think increases the scope of teams that we might involve in it. The other part of my question was, I think I'd already emailed you and you'd said it could be ward or community teams in terms of taking part in this, but when we discussed it with team leads about which team specifically might be involved, somebody asked the question, should this be a team that's settled and performing relatively well, looking them to take them to the next level, or would it be better to aim at a team that's maybe got more challenges at the moment, aiming to help them to think about it, which would be the better one to involve for the purposes of the collaborative?
Yeah, another really good question, Anna. The experience I have of just working with R50 teams says to me that this type of work, even more than any other kind of improvement work, we really need to make sure that the whole team is fully owning the decision to take part. You could work on an aspect of safety or flow with, just a few of the team really keen to do the work. This isn't that kind of improvement effort. The whole team is going to need to be involved, and particularly the unit leader, the team leader, because it's going to bring up some difficult material at times. And the leader of the team particularly is going to probably need some local support, which is why we need a sponsor, someone really quite senior from the organisation, actively supporting, understanding what's happening, and being willing to contribute and help when needed. So some teams are in such a state of flux or instability that actually they're not in a position to really get the best from this effort. And there's other things they need to do first. Maybe they need some OD input to really make sure they have some level of relationship stability, leadership in place before they go through improvement work. But that would be the same for any kind of improvement, I think. And I think your question about ward and community is a good one. If it was me, I'd be probably putting forward a range of teams from different contexts, because that's how we started the work at ELF, and it helped us learn how do you do this work in a busy inpatient ward, because it's likely to need a slightly different way of doing it to a community team or a team that's dispersed and hardly ever actually comes together physically, or a corporate team. So it might be worth thinking about bringing a range of teams to this.
I think it's just the cost that would limit us with that, but yeah.
Absolutely. Thank you. So I'm going to try and do this in the order of where things appear in the chat and where people put their hands up. So I think the next question was from Rachel in the Isle of Wight, which was about access to coaches, Amar. So how much access would a team get to a coach, and how will they deliver support?
At the moment it would be virtual. But as we've been transitioning all of our current programs to virtual, the coaches are actually more available than they probably were pre-COVID, in that they can join team meetings more frequently. So we'd be hoping, it depends on the volume of teams that take part, obviously, but we would definitely be hoping to be joining team meetings every couple of weeks, for example, and helping facilitate the process. To do improvement work, you have to be meeting every week or 2 weeks, really, to get the rapidity of learning and cycles of testing. So we'd be hoping that the coach would be able to join at least once a month, once a fortnight into those sessions, and be connecting with the project lead in between as needed.
That's great, thank you, Amar. I think the next one was a hand up, which was Dasana.
Hi, good morning, everyone. Hi, my name is Rajesh. I'm the medical director and the consultant psychiatrist at Signet Hospital, Colchester. So I think we are quite happy to be a part of this initiative. I just want to know, like ours is a small hospital, like 54 bedded, Amar. So would you ask us to enroll as a full hospital team, or is it like we can pick up few teams within the hospital? We have 3 or 4 wards. How does it work?
Yeah, so when I look at the way this work is being done across the world, Some places try to do this work as a really big organization or a whole hospital applying it, and it just doesn't work as well. For me, part of it is about, our experience at work is mostly related to the people we interact with on a day-to-day basis, and the people we're working closest with, which is why we've always chosen to do this work as a team, a microsystem. So, if you've got 54 beds, you've probably got, 2 or 3 wards. I would say each of those is probably a team in itself, and you probably get the best results from 1 or 2 of those teams joining, learning, what it takes to do this. And then, getting to John's question, I definitely wouldn't put all your teams for this, but you could probably learn something from the next year that you could then use internally to scale up. And we've certainly had a lot of teams from our restrictive practice work who had 3 teams taking part, learn from that sort of 18 months of support to think, right now, could we do this at greater scale ourselves internally using our internal QI infrastructure?
Thank you. Just one more question, sir, before you go. Amar, the outcome measures, how do you outcome it? Is there a specific measures? I think that's going to be difficult. The outcome measures. What would be that?
One of the challenges of this work is measuring it. So we actually have a design workshop with a range of stakeholders in March, where we're going to be sort of coming up with a design of this program. The measurement of it, there are lots of options, and places do this differently. There's some validated tools, but equally you want to keep the measurements simple enough and not onerous, not too onerous, so that people actually can focus on the changes they need to make and just capture enough data to be able to learn whether it's making a difference. So we'll be coming up with some sort of outcome measure, you're right, related to joy. I'll give you an example. At ELFT, we use a single question. Have you had a good day at work today? Mostly yes or mostly no. It's a really simple one question with a binary answer, and then 5 words after, say, just tell a little bit about why. And that was our approach to it. It's not necessarily what we're going to use here, but just as an example, we want to keep it simple enough that it's useful and usable and doesn't get in the way of people actually making the changes.
Thank you. Thanks.
Thank you. So Amar, you touched on John's question there. I think it's probably worth just going into it a little bit more. John, I don't know if you want to say more about your question.
Yeah, thanks. I think it's interesting, isn't it? It strikes me that it's not pure QI, and it's a combination of OD and QI and health and well-being, and they are all justifiable things in their own right. So, I'm kind of struggling. Is this a QI program? Because I'm sensing it has some QI approaches to it, but based on some of the stuff, Amir, that you've said, I'm kind of thinking it's more the OD end of it. So I suppose my question is then as well, where's the evidence of sustainability here? So what happens when the coach goes? £4,000 is not a cheap investment in a team. I'm not saying that's not a valuable investment, but when we think about the other things that are available, it would need some justification, and particularly in terms of organizations developing their own capacity to do this going forward, which is a sustainability question. Because otherwise, I'm not saying that this is the case, you feel like you have a bunch of management consultants turning you up, taking your watch, telling you the time, and once they go, you're kind of left kind of thinking, okay, where do we go next? So how would we address that with this particular program?
Yeah, I mean, good quality improvement work won't do that, John, because the team would be owning the process, and part of the method is about implementation and sustaining the gains. Not to say that every team manages to sustain the gains or even to see improvement. I mean, that's the nature of this work. It is absolutely robust QI work because it uses it's completely has fidelity to the method. And it introduces elements of organizational development into it. But ultimately, the science of OD and some of what underpins quality improvement have similar evidence base. So it's not surprising that when we're thinking about the outcome measure being about experience of staff, that we're going to introduce some elements of what might be thought of as the field of OD. Actually, when we do this work at ELFT, we make sure that every team has access to OD support if they need it. They don't all need it. but sometimes it is helpful for them to have OD support alongside the QI support, and that's why I think it's important to have a senior sponsor from each trust take part. I mean, if I was in your shoes, I'd be thinking, certainly for us at ELF, there's been return on investment from enabling teams to go through this process. We've seen the benefit, and you know, we don't. All of the teams that have volunteered to take part, and they've obviously seen something worthwhile in putting the time and effort into doing this work. Again, I would maybe try it out. It's a very different approach to how the NHS has traditionally gone, you know, tried to address the issue of staff experience, to devolve it right to the team level and give them the tools to be able to understand and improve it. So I would say this is maybe an experiment for some of us to see what value it adds.
That's a really helpful discussion. So Amy, you had your hand up for a while and then you put a question in the chat. I just want to check that question, what you put in the chat, covers the entirety of what you were wanting to ask.
Pretty much. So basically, I work in two teams, and I know that we've got funding for our team. So one thing I've been asked is, can two teams kind of join under the same umbrella group? One's an inpatient team, one's an outpatient team, or is that not a good idea? That's the first part of the question, really.
So the work they're going to have to do, Amy, is going to be really understanding how they work and how they work together, and what things get in the way of them having a good day and what things contribute to them having a better day. That's going to have to be done separately. If they're separate teams, there's no other route to do that work.
Okay. So the second question is, if one team is a bit more, what's the best word? If one team is a bit more cohesive than the other, are we better going for the team that's slightly less cohesive in order to bring them up? Or do you think it would be better to start with the one that is already quite robust and well established, and then use the experience then on the other team afterwards?
I might be tempted, Amy, to see what the teams feel about this, rather than us make a decision. In my organisation, we very rarely make a decision about which teams take part. We actually just ask them, would you like to take part, and how can you demonstrate that you are ready to take part, because this is what it will involve. And that might tell you something about which one is in a better place to do it.
Thank you.
So Amar, that kind of leads on to a question I was interested to ask. So we ask in the registration form, which I guess some people have had a look at, for certain things to be in place around having a project lead, a senior sponsor, a couple of other requirements. So do you want to just talk us through why we decided to ask that those things are in place for teams?
Yeah. So the registration form asks you to describe which teams are going to be participating from your organisation, and for each team, who would be taking the project lead role. Now, the project lead role does not have to be, in fact, in some ways, it's better that it's not the person who is in the formal power role in the team. And it can send an important message that someone else from the team is going to lead this work, actually, or co-lead it with the person who's actually the manager of the team. Every improvement project is going to need someone to take the lead, to make sure that the work is coordinated, that the actions are followed up, etc., to chair the meetings maybe. So project lead's critical. And then we ask for a sponsor, and I've already alluded to this before, but a sponsor is really someone who's in the operational sort of hierarchy, and so has some control over the system in which this team works, but a couple of levels up the hierarchy probably. And so with enough sort of power and clout and influence to be able to help when things get stuck, because sometimes a team wants to make a change and maybe that change isn't expected, or it goes against policy, and they need a bit of permission to try it for a week or two to see if it's going to help. Or where if a team comes up with some sticky material, some difficult material, that the sponsor can really come in quickly and help and support and bring in some sort of safe spaces where they can work through this. So We found in any kind of improvement work that having that sponsor just connects the team to the sort of organizational strategy. Why is this important to do? And, you know, someone to give them permission to say, look, this is really important and we're here to support you to do it. And you have our permission to make changes.
That's great, thank you. And I wanted to ask, in our other collaboratives, one of the things that we've asked people to have involved are patients or service users on the project team. So we've asked that we've said that actually co-production's kind of central to your improvement team if you are trying to reduce restricted practice or improve sexual safety. We haven't asked for that on the registration form this time, and I guess part of the answer for that, why that is because not all teams will be clinical for a start. But I did wonder still, Amar, what you thought the role of patients and patient involvement is in this sort of improvement work.
Yeah, I mean, I think there is still a role for patient involvement, service users to be part of this work. Some of the teams that have taken part in this work have involved their service users, and it's been really helpful for them to hear from their service users a little bit about what they see from their perspective about the team and how they operate. And sometimes it gives permission for the team to actually talk more openly about this when they hear the service users saying, actually, it makes a difference to me. And I can tell when you're having a good day and not a great day. And how can we help you to look after yourselves and make sure you're having a better day at work? That can be really helpful for teams. I think there are some sensitivities to having service users and patients in all of the work in the way that we might do for other kinds of improvement work, because some of what the team talks about is the way that the team operates, and it needs to be a really safe space where people can talk openly. And ultimately, the customer of the work for this type of improvement effort is the team itself. So they are the service users of this effort in a way. But I still think it's important to have a way for them to hear from the patients about what this work might mean and how they can contribute and help us with it.
Yeah, that's great, thank you. Benna has asked the question. They said, if we don't decide to join the collaborative, would we be able to hear for the learning and feedback from the work? I don't know, Benna, if you wanted to add to that, what you said in the chat there with your question.
Thank you. Yeah, Ben Waits, consultant clinical psychologist from Gwent in South East Wales. Yeah, it sounds really interesting, this piece of work, and we need to kind of think about whether it's appropriate for us at this point in time. But I guess it sounds like lots of really interesting stuff might emerge. So I suppose I'm particularly interested actually in the design of measurement, because certainly our experience of doing this kind of work before has been getting that measurement strategy right for teams is really important, and kind of sinks it if you can't do that. So it would be, if we're not able to join, it would be fab to have some feedback as you go along. But I'm also conscious that you're pitching something that you want people to pay to be a part of. So just thought I'd ask that question.
Yeah, that's a great question, Ben. And you know, as an improver, one of the principles of improvement is to be as transparent as possible and to share freely. So for every one of the improvement collaboratives we've run so far, we have made all of our resources available as soon as we possibly can, even before it's ended. So, you know, as we come up with some resources and materials, we will make them available. All of the learning from the learning sets we've always made available publicly. So yeah, absolutely. And we share quite a lot on Twitter. So absolutely, there'll be chances to see how this work develops and learn from it. Because ultimately, we want to be able to improve everyone's experience in working in the health and care system. And if some of this work you can take it and apply it in your own way, then absolutely, we'd want to support that.
That's great.
Yeah.
Lovely. Thank you very much.
On the measurement question, if you're interested in that, just have a look at the IHI white paper, because in the appendix, there's a range of validated measurement tools that you can look at.
Thank you. So we had a question from Emma, which I think Christy has answered in the chat about the financial requirements and the subscription cost, basically. I would just add to that answer that we are able to take payment at any point during the year. So we could take it before the end of March, or we could take it after the end of March, which those things may or may not be better for organisations, I know. So we are very completely flexible on that. We have a different financial year to the NHS, which enables us to do that. Does that answer your question, Emma? I just wanted to check before I move on. Oh, Okay, I'll take that as a yes. So the next question from Parashar, sorry if I pronounced your name wrong, is about the learning set. I don't know if you wanted to say a bit more about that question.
Hi, it's Parashar. I'm from the Royal National Orthopaedic Hospital, psychiatrist here. Yeah, it was just to do with the action learning set. So I was interested in knowing whether we would remain within the same set as you go through. I had assumed we would, but seeing just the range of participants and quite how many teams, may be taking part, I don't know whether we would then change or whether we'd stay the same, or that's yet to be decided. That was it.
Yeah, it's not exactly the same as an action learning set. What we design is learning sessions, which are designed to enable people to learn from each other and accelerate their progress. So that will include a range of different things. It will be some plenary time with maybe some external experts coming in to give some ideas and evidence base that can inform people's theory of change. And it will involve some time in smaller groups. So, there might be times where we bring teams together that are similar type of specialist teams, because they could learn effectively from each other about what works in their context. But there might also be different times when we bring teams together that are working on the same driver. Say they're all trying to test out ideas on participative management or reward and recognition. We could get them all together to say, right, what ideas are you testing? What am I testing? Could we pinch some ideas from each other? What seems to be working? So actually, it's not a defined learning set that you'd be with the whole time. Every 2 months, we would be designing the time differently to make sure we're adapting in real time to what the teams need.
So can I follow that up then? Would those learning sessions, would that be just for the project team or certain members of the project team, or for the ward? How would that work? So the project team, so that the team that's taking part, they'd be invited to join, and because it's virtual now, actually there's a lot more ability for larger numbers of people from the team to come and join actually. So we'd be inviting the whole team to join, as many of them as they could. Okay, thanks.
Yeah, it's worth saying that our capacity when we were running the learning sets in person was probably about 160 in the room, people in the room at any one time. But yeah, we have a unlimited capacity with virtual, and if we move, we're also looking at when we move back, is there a way of doing that in a hybrid way so people could join virtually or in person? So, but the principle will be one session that everyone's at and as many people from your team as you can, but we'll probably split some of the discussion into communities of interest, I suppose, or people looking at a particular thing. So we're moving to the last 5 minutes or so now. I'm just going to go to Nicole in Leeds, who's got a couple of questions. Perhaps I'll hand over to you, Nicole.
Hi, so I'm Nicole Child and I'm an improvement manager at Leeds and York Partnership. I've just got a couple of questions. I suppose the first one really was in relation to the time commitment. So the first thing our teams are going to ask about is, what should they be expecting to give out of their week to take part in this? I just wondered from the teams that have gone through it at your trust, what that looked like for them on average, maybe.
Yeah, I think it's pretty similar for any kind of improvement effort. It's not any different for this. If they were improving flow or they were improving some safety issue, and using quality improvement, they'd probably be meeting as a team for half an hour a week. Just once the work gets going, a half an hour a week's probably enough to sort of check in on what did we test last week? How did it go? Should we tweak it for next week, or should we come up with a new idea and let's plan the test and let's go away and run it? Half an hour to an hour is enough to do that in. At the beginning of this work, it might need a few slightly longer sessions as to do the appreciative inquiry and to understand the baseline data and things like that. So maybe at the beginning, 1.5 hour sessions every couple of weeks might be useful, but once you get into the rhythm of it, it should be quicker than that.
Okay, great, thank you. And then my second question was just around, so the teams that we were looking to work with on this would be inpatient teams who have been really pushed through this pandemic and are really quite struggling around this whole sort of health and wellbeing part. Do you have any experience in the work you've done at your trust with doing it with busy inpatient teams, and how's that landed?
Yeah, of course we have. And it just needs a little bit of thinking through about, who will lead this work, because often if everyone's on shift patterns, that leadership role needs to be shared, and where is the best place in the way the team works for them to actually come together and do this work. And sometimes it's more useful to sort of think about integrating this into the sort of huddles they may have, or the business meetings, or the handovers, rather than try and create a separate space for it. And again, you know, the team will know best how to make this happen, and for it to be live in the discussions they're having in the ward. So yeah, absolutely. We've worked with inpatient wards throughout the restricted practice work and the sexual safety work, so we're pretty used to helping teams find regular space to do work like this.
Thank you.
Great, thank you so much. So we're coming to the end of the time we've got. I had a couple of more things I was going to say before we finish, but can I just check whether there were any more questions? There's been a couple of more questions in the chat, which I think have been answered in the chat, about the recording and the IHI white paper. But are there any other questions that people had before we wrap the session up? Okay. Looks like not. So we at the moment we've got a deadline of the 5th of March for people to sign up to this program. Obviously, people will appreciate we need a deadline to make sure we can get the resources in the right resources to be able to deliver or support all the teams in the best way and organise that. But I will say, if there are people who are in a circumstance where actually they're waiting for someone to sign off the finance, and that'll be a few days more, or they really want to join but just haven't been able to get everything quite in order for the 5th, please contact us. We'll work with you on that and show some flexibility with it, although obviously please bear the deadline in mind. Okay, so I think that's takes us to the end of the session. So thank you so much everyone for joining. Some great questions. Thank you, Amar, for being under the fire of all those questions.
I just wanted to say, if people still have any questions that they haven't thought were answered really well today, that I'm really happy to pick up in a phone call with anyone if they think that would be helpful over the next week or so. And Christy, if we could just upload the registration form into the chat, it might make it really easy for people to pick up and just have a look at.
Yep, no problem.
Okay, sorry, we just had a last question in the chat, which I think seems quite important, from Rachel in the Isle of Wight, which is when will we hear if we're able to join? So just to say that we will be contacting all the teams who have joined after the deadline in March about kind of the next steps. But if you've submitted your form and you have the right things in place that we've asked for on the form, we will you do have a place. It's not a case that it's not a competitive process. We won't be selecting teams. So if you have registered with those things in place on the form, then you will be on it. We'll be in touch after the deadline to let people know. And thank you, Emma, for your comment about the team on sexual safety. Okay, thank you everyone so much, and goodbye.
Thanks everyone.